Hello, welcome to my capstone presentation on palliative nursing care for the client with end-stage COPD. I am Latanya Fuentes, and I was lucky enough to do my preceptorship at Good Samaritan Hospital on the medical, surgical, and palliative care unit. COPD stands for chronic obstructive pulmonary disease. And what happens is a chronic airway obstruction causes an overproduction of mucus and chronically expanding alveoli and trapping air in the lungs. This results in a lack of oxygen absorption and leads to chronic hypoxia and chronic hypercapnia. This also you'll see in COPD patients, the expanded alveoli results in a barrel chest appearance. It is known that 90% of cases are caused directly from smoking cigarettes alone. So what interested me in this population was seeing so many patients with COPD during my preceptorship. It showed me how much more common the disease is than I realized. Something that surprised me was changing my thinking of palliative care. I always thought it was more like hospice and basically the very end of life for patients. However, I learned that palliative care is more of a psychosocial care. It is making sure the patient has their spiritual and mental health needs, along with their treatment and pain management, to make sure the patient is holistically cared for and having the best quality of life possible. Another interesting find is literature states of how patients typically develop right-sided heart failure. I noticed in preceptorship, every single patient I had that had the end-stage COPD also had the right-sided heart failure. It was really interesting to see how the literature was so approximate with this information. A few things I would like you to take away as important from my poster is how prevalent depression and anxiety are in this population. They have a hard time breathing and usually have panic attacks from overexertion, just from trying to do normal activities such as walking to the bathroom. They also have their depression from how debilitating this disease is. It really plays a role on them. And they also are, coping with their shortened life expectancy. Another key point I believe is very important to take away is making sure these patients fill out an advance directive and have an end-of-life discussion with their healthcare providers about their disease progression and their wishes. As you will see on my poster, it is not a common occurrence and should be with every single palliative care patient, not just COPD. This leads to my last takeaway, which is it is important for these patients to be referred to palliative care as soon as they are diagnosed with this disease, so they can start receiving these services early to have a better quality of life. Thank you so much for taking the time to watch my presentation. I'd like to give a special thank you to my professor, Dr. Zeichkin, for his guidance and feedback. I would also like to thank Patricia Manalo for taking the time to edit and give valuable feedback also. I would also like to give a huge special thank you to my preceptor, Emily Belton, for being a wonderful preceptor, teaching me so much and showing me how important palliative care really is. And last but not least, a special thank you to 3-4 River Medical, Surgical, and Palliative Care Unit at Good Samaritan Hospital for coming together while supporting me and teaching me how to be a great nurse. Have a wonderful day